So in today's session, we'll cover the topic of diet in diabetes mellitus. Those who have the textbook, page number 406. Page number 406, chapter 19 is diet in diabetes mellitus. The important facts, myths, principles, guidelines of formulating a diet in diabetes mellitus, what to be avoided, what has to be included, what are the complications, what are the different tests to diagnose diabetes. Okay, these things we will learn today. So if anyone is joining late, please help them out with the page numbers. So what is diabetes? There are two types of diabetes, broadly speaking. Okay, two types, type 1 and type 2. There are other types of diabetes as well. Okay, but broadly speaking, two types of diabetes. So in a healthy body, your pancreas, you can see here, this is the pancreas, the yellow color, tapered kind of organ. They produce insulin. Okay, insulin is a hormone, and because of which insulin will help the glucose to be carried in the bloodstream, that the glucose that is carried in the bloodstream, insulin will direct this glucose to be taken up into the cells. Every cell in our body have this insulin receptor. Okay, as soon as insulin is secreted, insulin receptors will catch hold of insulin, and as soon as the insulin receptors are holding the insulin, they open the channels for glucose to enter the cells. So like in this pathway, glucose which is present in the blood goes down because it is getting absorbed into, it is getting into the cells. And this glucose will be used by the mitochondria and the cells and etc. for giving out energy. Okay. So this is how a normal mechanism takes place. So insulin has to be received, okay, by an insulin receptor. When the insulin receptor and insulin make the bondage, channels open up for the glucose to enter the cell and be utilized for energy purpose. So in type 1 diabetes, what happens is that pancreas are not able to produce insulin at all. Okay, so the blood glucose level will remain high. There is no insulin being produced. There is no one directing the cells to open up the channels so that glucose can enter. You can see here the channels are shut. Okay. So here the glucose stays, more amount of glucose will stay out of the cell, specifically in your bloodstream. Okay. In type 2 diabetes, insulin is produced. Pancreas can produce insulin. That too large quantities of insulin are produced. Okay. But what happens is that the cells do not respond to insulin. Insulin receptors may be available, but it is not responding to insulin. When insulin comes here, cells will shut down its door towards insulin. Cells will not receive insulin at all. Cells will not respond to insulin at all. So what happens? Very few channels, some is receptors which can still allow insulin, only they will allow the channels to open up and only some amount of glucose can enter, other glucose cannot enter. Okay. So this is type 2 diabetes. Your pancreas are producing insulin, but the cells are not responding. Your body cells are not responding to insulin. Okay. Is it clear the difference between type 1 and type 2 diabetes? And type 2 diabetes is the most common type of diabetes we have. Type 1 diabetes is kind of an autoimmune disorder in which the cells, the beta cells of the pancreas, which are producing the insulin, they get attacked by your own immunity. The own immune system will attack the beta cells from the islets of Langerhans. Okay, pancreas have this islets of Langerhans, which has alpha cells and beta cells. Beta cells are supposed to produce insulin. Alpha cells will produce glucagon. Okay, so these cells get destroyed because of your own immune system. So it's an autoimmune disorder in which the cells that produce insulin is destroyed. So there is no insulin production. Okay. And type 2 diabetes is diabetes mellitus, which is very common. Worldwide, it is common. A blood test is done. Okay. In blood test, you can understand if you have insulin, if you do the blood test and your bloodstream has insulin, what does it mean? Your blood serum, your bloodstream circulating blood has insulin. What does it mean? And still your blood glucose levels are high. What kind of diabetes it should be? It's type 2 diabetes because insulin is produced. Okay, when you do a blood test after eating, after giving the patient 75 gram of glucose or something, and you check the blood, there is no insulin at all in the blood. It means insulin is not produced at all. That is type 1 diabetes. Usually it is called juvenile diabetes as well. It happens in kids. From a very early age, type 2, type 1 diabetes can occur. Okay. So this is the anatomy of the pancreas. So this is the islets of Langerhans. You can see a lot of beta cells and few alpha cells. Beta cells will produce insulin. Alpha cells will produce glucagon. Okay. Insulin will lead to decrease in the blood glucose levels. Glucagon leads to increase in the blood glucose level. Okay. They have opposite action. When your blood glucose levels are too low, okay, too low levels of blood glucose levels are also it's also very critical condition. So in that case, glucagon has to be released so that blood glucose level can increase. Okay. There comes a time when your pancreas, it happens in old age, when pancreas are not able to produce any insulin at all. Okay. So based on that test result, insulin is prescribed. Not every diabetic patient will require insulin. Okay. If it is early stages of diabetes, you only require anti-diabetic drugs. Okay. But when it is later stages, usually it happens in senior citizens when majority of the healthy cells in the pancreas also destroyed because of any inflammation. Okay. Any autoimmune disorder because of which complete production of insulin is hampered. Okay, in that case, only diabetes patients will be put on insulin. Okay, or their pancreas are producing insulin, but not enough to tackle the blood glucose level. Just to aid it, insulin can be prescribed. Glucagon usually directs your liver to release the stored glucoses. Liver stores glucose. Glucagon can ask the liver to release more glucose, or glucagon can also undergo certain changes, and it can convert itself into glucose. So these two mechanisms can take place. If you are in a pre-diabetes stage, pre-diabetes is also a type of diabetes in which abnormal glucose levels are present in your blood, but it is not high enough to diagnose you as a diabetic. Okay, abnormal levels of blood glucose levels are present, but it is not enough to meet the criteria to be called as a diabetic. Okay. Specifically, you have to do your HbA1c test. Okay, that is the glucose levels in the hemoglobin. Okay, so if it is between 5.7 to 6.4, that is pre-diabetes. Okay, and if it is more than 6.5%, Okay, the glucose levels in your hemoglobin is more than 6.5%, it means you are diabetic. But if you are between the range of 5.7 to 6.4, it is pre-diabetes. So in the stage of pre-diabetes, you can reverse your body back to a normal health. We are doing lifestyle changes, lifestyle modification. So approximately 61.3 million people in India live with diabetes, and nearly around 9 lakh annual deaths directly or indirectly attributed to diabetes, because diabetes can aggravate other healthcare conditions, specifically the challenges of heart disorders, challenges of kidney disorders. Okay, HbA1 test. Okay, HbA1c is the test name. Number of children who live with type 1 diabetes, as I mentioned, type 1 diabetes is also called as juvenile onset diabetes. It happens, majority of the type 1 diabetes takes place in young children. Okay. Indians get diabetes on an average of 10 years earlier than their Western counterparts. It's because of the gene mutation that the Indian population has undergone, because the series of famines our ancestors have endured. Okay, even before the British rule, during the British rule, okay, the series of famines that the Indian population, then Indian population, our ancestors have endured. Because of that famine, the Indian population has this genetic mutation that the not all, but majority of the tribes and caste have undergone, specifically the lower castes and lower tribes and everything. They have undergone this genetic mutation in which the body is made to survive even with very less amount of food. So what happened right now is that after independence, when globalization happened, okay, when all the people from different caste, okay, lower caste are coming up, okay, and all the backward castes, backward tribes, they are also coming up in the workforce. They are able to earn, okay, they are able to buy more things, access more food. And since 1992 globalization, uh, globalization which was allowed in India, a lot of fast food entered into India from the Western market, and our population had the money since 1992, and even before that, our population gained access, had money to buy more things, buy more nutritious food to feed themselves, to provide for the family, as compared to what our ancestors during the independence or around the time of independence could even afford. Okay, so naturally the Indian bodies are built in such a way that we can survive in very less amount of food. Our body requires very less amount of food for survival. But the accessibility that the money has brought in, the economy and the globalization has brought in, has made this disbalance. Our genetics is not allowing us to digest or to metabolize the accessible food that now we are piling up and buying. Okay, so this is the reason why Indians get diabetes earlier than Western population, even though the rate of obesity is quite higher in Western population. You have to be obese. Only majority of the diabetes cases happen to overweight and obese people in Western countries. But in India, even if you're not obese, even if you're not overweight, you have a lean, fit frame, but still you can get diabetes. This is because of this genetic modification that happened during famines. Okay, this is one of the reason why. So is it clear to all regarding the epidemiology of diabetes in India? So type 1 diabetes, type 2 diabetes. type 1 diabetes occurs when the pancreas are unable to produce enough insulin, tends to develop at a very young age, cannot be prevented. It completely requires the child to be put on insulin therapy from a very young age because the pancreas are not producing insulin at all. Okay. Type 2 diabetes occurs due to insulin resistance. As I mentioned, in early stages, the cells will resist insulin. Insulin receptors will not function well. Body does not respond, your cells does not respond well to insulin. It tends to develop at a much older age. Okay, even in young adults it happens. Insulin resistance can happen as young as teenage, early 20s. Insulin resistance can begin. Okay, it can be prevented with lifestyle changes, can be managed with lifestyle modification if it is diagnosed early. Not every type 2 diabetes will require insulin therapy. Okay, only when there comes a stage when it is a chronic diabetes, okay, and your pancreas are giving up production of insulin. Only in that situation, insulin therapy is required. So the symptoms are very same in both the cases. Okay, only the pathophysiology is different, but the symptoms are very same. Frequent urination, increased thirst, extreme hunger, unintentional weight loss because body is not utilizing glucose for energy. Okay, cells are not taking up glucose for energy. Body requires energy to survive. From where this energy will come? By breaking down the fats. Okay, our first go-to source of energy is carbohydrates, glucose. If you don't get that, the body will cut off the fats from the body. Okay, that's how you get this unexpected weight loss when you are diabetic. Blurry vision, sores or wounds that heal very slowly, numbness or tingling sensation at the ends of your hands and feet. Okay, so they both this group of people, type 1 and type 2, they can benefit from lifestyle modification like healthy diet, physical activity, regular blood sugar level monitoring, management of stress. Okay. So type 1 etiology. First is genetics. It runs in the family. Okay, inheritance of type 1 diabetes genetics is polygenic. It has been estimated that over 50% of heritability is contributed to HLA class 2 genes. This specific class of genes, when it is present, chromosome 6, okay, this particular genes is responsible for causing this autoimmune disorder. Okay, so it is based on genetics. Then infections. Any child during their infancy, preschool age, when they have chronic infections or recurrent infections, and if it was triggering the pancreas, okay, infections that were affecting the pancreas, there are high chances that the child may suffer from type 1 diabetes soon. Then acute stress. So even when the body is in a stressful situation, the body releases a lot of adrenaline, noradrenaline, and cortisol hormones that naturally will raise your blood glucose levels to provide quick source of energy to cope with stress. Okay, when you are stressed, your body requires a lot of energy to give you the coping mechanism that, okay, you can overcome this, you can run from this situation, you can overcome this, you can do something, do some activity so that you can overcome your anxiety or stress. Okay, so naturally when you will always be stressed, your body will always secrete this adrenaline, noradrenaline, cortisol, etc. And what happens is that your blood glucose levels will forever stay high. Okay, and that would lead to type 1 diabetes. Then immunological factors. It is a slow autoimmune disease where your own immunity is going to attack the beta cells of the islets of Langerhans, which produces insulin, and that's why you get type 1 diabetes. So this is the etiology of type 1 diabetes. Etiology means causes, what leads to this condition. Coming to the etiology of type 2 diabetes, lifestyle, people who are obese, not active, overeat. Majority of the middle-aged diabetic patients are obese, okay, and Also, insulin resistance. If you're a woman, you have suffered from insulin resistance from a very long period of time, there are high chances you will get diabetes soon. Higher intake of refined grains, which have high glycemic index, like white rice, polished white rice, okay, combined with sedentary activity, cardiovascular disease. So these are the reasons how lifestyle can affect the etiology of type 2 diabetes. Having low fiber diet. Yeah, adrenaline and epinephrine are the same thing. They are different names. Adrenaline, adrenaline, noradrenaline, epinephrine or norepinephrine. These are the same thing, okay? Then we have age. Genetics also plays an important role. If genetically, if you look at your grandparents or parents, if both of them or majority of the people in your family suffer from diabetes, okay, even extended family, majority of them, this diabetes is a common disease among your family members, your risk will also be high in developing diabetes early on, okay. Then age. Majority of the new cases of type 2 diabetes occur among people who are over the age of 45. So after you have crossed your midlife. Then abdominal fat. People who have a higher waist to hip ratio, which means your waistline is higher, is much more than your hip line. Okay. Apple shaped body. So they have higher chance of developing type 2 diabetes. Pear-shaped waist in which the waist is less and the hip line is wide, that is pear-shaped body, lower risk of cardiovascular diseases and diabetes mellitus. Okay, those who have an apple-shaped body, they have higher risk. It means that it's not that you are born with an apple-shaped body. It's not like that. If you carry a lot of fat, if you carry a lot of abdominal fat, your risk of diabetes is high. Then insulin resistance. So in insulin resistance, majority of it is very prevalent in women who suffer from polycystic ovarian disorders. Early, even in teenagers, late teenagers, young women, okay, even before they hit the age of 25, insulin resistance is very prevalent. Okay, so what happens in insulin resistance is that your pancreas are making insulin, but your cells are not responding to this insulin. They are not ready to respond to insulin. They shut the doors towards insulin. They do not allow the glucose to enter. Okay. If cells do not have the glucose to produce energy, what will happen? The glucose will be left out in the bloodstream. But blood has to bring the homeostasis. So majority of the sugar that is left out in the bloodstream, they will be transformed into fat and it will be stored in your adipose tissue, in your fat tissue, fat cells. Okay. So you get chubbier, you get fatter and fatter over the period of time, and you do not even have energy. You are eating food. You may be eating all the right kind of food, but the carbohydrates in that food are not able to provide energy to your cells. Okay. So what happens is that you are uh, 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 collecting those glucose that is converted into fat in the body. Your weight is increasing. And since you do not have energy, the cells do not have glucose for energy, you will always feel tired and hungry to eat more. So it's kind of a vicious cycle. So this is insulin resistance. Yeah, insulin resistance, if not treated with the lifestyle modification, it could lead to type 2 diabetes. And diabetes can happen even before you get menopause. If you correct the insulin resistance with by correcting your zinc deficiency, it is seen that people who have resistance, there are high chances that they may be deficient in zinc as well. If you correct the zinc deficiency, you can reduce the insulin resistance in your body as well. Coming to the symptoms, hyperglycemia, when insulin is not produced or it is ineffective, the formation of glycogen is decreased, and yet the utilization of glucose by the peripheral tissues is also reduced. Now, what happens is that blood is carrying a lot of glucose. Blood is circulating with a lot of glucose. So that is why you get hyperglycemia. Too much of glucose in your blood, circulating blood. So glycosuria, the exact link of zinc deficiency and insulin resistance, like it's not clearly given, but it is written that in Indian subcontinent, a lot of people suffer from zinc deficiency, and this is the same group of people who suffer from insulin resistance as well. So there could be some link to it. And correcting the zinc deficiency is able to show positive impact on insulin resistance as well. It is said that zinc is kind of a micronutrient that can help your cells to be more sensitive towards insulin. Okay, having zinc, an adequate amount of zinc in the body, it can make your cells more sensitive to insulin. So that's what we require. You want the cells to respond to insulin. So zinc can help out with that. Glycosuria, when the blood glucose levels are exceeding the threshold level, okay, where it is creating, that is more than 160 to 180 mg of glucose per 100 ml of blood. If that is the situation, your kidneys will step in and try to collect maximum glucose and filter it out. Okay, so that's how you get glycosuria. Then fluid and electrolyte imbalance. Loss of glucose in the urine represents a wastage of energy, and it entails an increased elimination of water and sodium, because the kidneys are trying to maintain that homeostasis in which the body's blood glucose levels are normal. So kidneys are constantly in the drive to take out as much as glucose as possible. So in that drive, a lot of fluid and electrolytes are also lost. Okay, when the kidneys are trying to get rid of excess of glucose, a lot of fluid and electrolyte is also lost in the same way. Then acidosis. So as I mentioned, when the cells are not responding to insulin properly, the body requires energy from some or the other way. So the next stop is your fat stores in your body. Okay, so a lot of fats will be broken down to give energy, but ketones ketones are the byproduct of this fat metabolism. Okay, when the fats are being broken down to give you more energy, you have ketones as a byproduct. What does this ketone do? Ketones will alter the pH level in your blood. Okay, too much of ketones in the blood, your blood will turn more acidic in nature. Okay, so that's how you get acidosis, because a lot of ketone bodies are released in your bloodstream because a lot of fat metabolism, fat lipids are being broken down for energy. The byproduct of this reaction is the formation of ketone bodies. And ketone bodies will make your body more acidic in nature. Your blood also more acidic in nature. It will alter the pH levels of your blood. Okay, so that's how you get acidosis. Ketoacidosis is also another name for the same situation. So when a person is suffering from diabetes, the amount of ketones that are produced, it far exceeds the ability of the tissues and other parts of the body to utilize these ketones. So the concentration in the of ketones in the blood is quite high, and thus you get acidosis. Acidosis. And because of this, how do you understand a person is undergoing acidosis? They will have a fruity odor, okay, fruit kind of breath. The smell of the breath will be very fruity in general. So that means the person may be suffering from ketoacidosis. And also when you check that urine, when you do the urine analysis, the same situation, how the kidney is trying to take away maximum glucose through urine. The kidneys will do the same thing for ketones as well. So a lot of ketones will be uh, excreted out of your body through urine. So it leads to ketonuria. Okay. A test is conducted for that as well. If you have ketonuria, it is also a diagnosis for diabetes mellitus. People who follow this keto diet and all, a lot of ketone body is produced in their body as well. Okay, but it is targeted. Okay, the amount of the exact amount of fat and which type of fat they're gonna have in the keto diet is pre-planned. Portion sizes are controlled. Okay, and 5 to 10% of diet energy comes from carbohydrates as well. Okay, so automatically it creates a balance so that the body is not overproducing ketone bodies. Okay, it's written in the textbook, not in healthy people, but those who are diabetic. Okay, those who are diabetic, they produce these ketone bodies at a far higher rate as compared to a healthy person. Usually, it's a healthy person who goes into who is not diabetic, etc. They usually go for keto diet, so they don't have to worry about acidosis. Then we have polyuria, nocturia. A lot of times you will go to the bathroom to urinate, and specifically at night. Okay, the rate of urination increases, that is polyuria, and specifically at night, urination during night increases. Polydipsia and polyphagia, thirst mechanism, increased thirst, that is polydipsia. Polyphagia, increased hunger. Okay, why increased hunger? Cells do not have energy. Cells are not getting energy. Even though you're giving them food, cells are not able to take energy from the glucose. Okay, so the body will forever be in the state of in a hungry mode. Okay. Then we have dehydration. Since there is polyuria, nocturia, there will be also a situation of dehydration when the fluid becomes hypertonic in nature and water leaves the cells to tone down the water. The reason being, you take blood, for instance. Blood has high glucose in diabetes mellitus. Okay, in situation of diabetes mellitus, high blood glucose level, high ketone bodies in the blood. Okay, osmosis will be in play here. What will happen? The body, what trick the body can do is take the water out of the cells, put it into the blood, so that the hypertonic blood, now the blood is in a hypertonic situation. It is very concentrated with glucose and ketone bodies. To reduce the concentration of anything, what you require, you have to dilute it with water. The same mechanism is happening in your body. You are diluting the blood with water. And where does this water come from? It comes from your own cells. Okay, the water from higher concentration to lower concentration. The movement of water from higher concentration to lower concentration takes place. Okay, so that's how your cells get dehydrated. At a cellular level, you get dehydrated. Okay. Then fatigue and weight loss. Since a lot of energy will be utilized from fat metabolism, which leads to weight loss. And also a lot of fluid is lost from your body, okay, because of frequent urination. A lot of fluid is, water weight is also lost. So you will see a drastic change in your weight. Increased excretion of potassium and magnesium and phosphorus, because along with urination, okay, these electrolytes will also be excreted from the body through frequent urination. So these are the symptoms of diabetes mellitus. Is it clear to all? Hypertonic, as I mentioned, when you are diabetic, your blood becomes hypertonic because the concentration of glucose and ketone bodies in the blood is quite high. Any solution which has high concentration of any electrolytes, okay, it is called hypertonic. So to tone down the, to dilute the blood, to tone down the blood, to make it isotonic from hypertonic, more water is required. And from where this water will come? From your own cells. Water will flow out of your cells into the blood to make it isotonic, to bring that homeostasis back into the blood. Next, diagnosis. Glycosuria, presence of glucose or sugar in the urine, is first evidence of diabetes. So this glucose urine test is available. Dipstick methods are available. You can do that as well. And usually the urine that you are urinating or voiding just before having the first meal of the day, that is the first time when you go for urination in that day, that urine is required to diagnose this. And then we have ketonuria. Again, in ketonuria also you have paper sticks or dipsticks that will change color. In glycosuria, you can do this Benedict's test. Okay, Benedict's solution will be added into urine, equal amounts of Benedict's solution. That's usually what you use. So Benedict's test, equal amount of Benedict's solution is added, and the test tube will be heated, okay, for 5 minutes approximately. And then you will see the color change. If there is no color change, it's normal. The urine does not have any sugar. Slight color change into green, traces of sugar. Orange, moderate amount of sugar. Red, there is large amount of sugar. Okay, so if it is orange and red, the person is diabetic. Blue and green, the person is non-diabetic. Okay. This is the ketone test. Dipstick is available. So completely saturate the test end of the strip with urine, collected urine solution. Shake off the excess urine and wait for at least 15 seconds. And whatever is the color change, you will have uh, a key, a color indication key available. So based on that color change, you have to assess what is the situation of this urine sample. Okay. If it is dark, if there is a dark color, there is ketones present. If there is a light color, ketones are not present. Something like that diagnosis will be given. So that is a dipstick method. The random blood glucose level test, any time of the day, randomly just check the blood glucose level. If the random blood glucose level is anyway higher than 200 mg per deciliter, that it is more certain to indicate the person is suffering from diabetes. Okay. A healthy person, a normally healthy person, will never have a random blood glucose level which is above 200 mg per deciliter. Then we have glucose tolerance test, GTT. So here, when you are fasting early morning, your blood sample will be drawn. Okay, and then 75 gram of glucose dissolved in 300 ml of water is given. You can add lemon juice as well, just to make it like easier to taste. Then blood and urine specimens are collected every 30 minutes for the next 2 hours. And whatever is the results of your blood specimen and urine specimen will be plotted on the graph. Okay. So here you can see a person who is normal, the fasting blood glucose level will be quite less than 100, okay, around 90 or 80, okay. After you give them the 75 gram of glucose, blood levels will increase. There will be a spike, but you can notice here, even though there is a spike, it's not crossing 150, okay. It's below 150. And after every 30 minutes, when you take the blood sample, and for the next 2 hours, every 30 minutes, when you take the blood sample or urine sample, you will see slowly the blood glucose levels are coming down back to normal. Okay, back to normal and the fasting level within 2 hours. Okay, so this is what happens in a normal human's body. A person who has an impaired glucose tolerance test or pre-diabetes, okay, their fasting blood sugar will be slightly higher, but not more than 120. Spike is high, but not more than 200. Okay. And when the blood glucose, when it comes down, it does not comes down in a steep way. It comes down in slightly high, low, this kind of a situation. That is impaired glucose tolerance. We can safely say that this person could be in the pre-diabetic zone. Okay. Now the person who is diabetic, if you take the fasting blood sugar level, fasting blood sugar sample, it's also high. It's more than 100, very close to 150. This is the fasting blood sample, okay, or urine sample. After you give the 75 gram of glucose, the glucose spike is so high, it is almost near to 250. Okay, 250 sorry, 250 mg. And then it is supposed to come down, but it will never come down to the fasting stage. Up to the fasting stage, it will always, even though the blood sugar levels are coming down, it will not come down equal to the fasting stage. It will stay still higher up than the fasting stage. Okay, so this is diabetes mellitus. So impaired glucose tolerance test, usually it is seen in people who have obesity, okay, who have to be more careful with their diet, who are supposed to lose their weight, avoid obesity so that they don't get diabetes. Usually the people who suffer from pre-diabetes situation, they come under the impaired glucose tolerance test. Is it clear to all the diagnosis? Next is treatment. Treatment has a lot of options based on what kind of results the patient has, and it is decided by the endocrinologist or diabetologist. Okay, they will decide what kind of treatment is required in this particular case. Majorly, just by dietary measures, you can solve majority of the issues. If you come from a high risk uh, background, okay, high risk background, or you come in the category of pre-diabetic. So a lot of dietary measures can prevent the onset of diabetes. So diet, and then diet plus hypoglycemic drugs. Okay, for this is prescribed for people who have insulin, whose pancreas are producing insulin, but their blood glucose levels are remaining high. For them, hypoglycemic drugs will be prescribed. Diet plus hypoglycemic drugs. Impaired glucose tolerance test is usually is the result that you get for a person who is pre-diabetes, who is in the category of pre-diabetes. Then diet plus hypoglycemic drugs plus insulin for people who cannot produce insulin at all. Repeatedly, urine testing has to be done. It should be a regular part of your routine. Blood glucose monitoring also. So in dietary practices, so if you are able to maintain your weight and waist circumference, okay, lifestyle interventions at early stages can reverse type 2 diabetes, okay, and it can also have long-term health benefit. Food exchange list can be used here to restrict the food intake to according to the insulin prescription, or to prevent having refined grains, prevent having high glucose content in food, have more fiber in diet, have more complex carbohydrates. Okay, using food exchange list, it can be helpful to add more protein. So you can use this BRCA index to identify what is your ideal weight for your body. So whatever is the person's height minus 100 for men, if they are a man, height minus 100, it will give you your ideal weight. For women, height minus 105, that will give you your ideal weight. So this is BRCA index. Very simple to use, easier than using body mass index. And BMI is the body mass index, weight in kilograms divided by height in meter square. Convert the height from centimeter to meter, and you have to find the square of it. That will be the denominator. Weight in kg will be the numerator. So those who food exchange list, which is on page 24, around 20, it's in the chapter of menu planning. Okay, page number may be slightly different. It's 25 and 26 right now in the new textbook. Page number 25 and 26, food exchange list is given. You can use that. Table 1.12 in the same textbook. Okay, food exchange list can be used. BRCA index will be much more better to use. BMI is kind of, to be subjective with BMI is very difficult. Okay. BRCA index would be much more personalized. So a group of food which has the same caloric value, same protein, fat, and carbohydrate. Portion sizes will be slightly different, but the caloric value is same. Can be substituted for one another in a meal plan so that people will not feel monotonous. They will not feel tired of having the same thing again and again. Okay, to bring that excitement and to bring that variety in the daily menu plan, food exchange lists are used. The main purpose of food exchange list is that portion size can be slightly different, but you can be sure that caloric value, protein, fat, and carbohydrates are more or less very similar in this different type of recipes. Okay, so that is the use of food exchange list. And you can also maintain the body weight with having different variety of food. Then diet and insulin. In juvenile diabetes, diet therapy will be given with insulin. In juvenile diabetes means type 1 diabetes. There is no other way. The patient will be put on insulin. Diabetic patients, they only if their kidneys are affected, they have to reduce their protein intake. Otherwise, their protein intake can be as normal as a healthy person. Only if they have any nephrological issues, okay, if they have some nephropathy, this kind of situation, only then the protein restrictions will come from the nephrologist. So, diet and insulin, juvenile diabetic cases, the food intake should match the insulin secretion or insulin that is provided. Okay, so very controlled food will be given to children who suffer from type 1 diabetes. Hence, the requirement of insulin has to be adjusted very often, keeping it regular with the growth and development, because children grow very fast. They require high energy food. Okay, they grow up very fast. So along with that growth, their hunger, the amount of food that they eat will keep on changing. Okay, it keeps on increasing at a very rapid rate. So you have to be up to date with the insulin injections as well when you're dealing with the type 1 situation. Then we have Daphne, dose adjusted for normal eating. Daphne here means insulin dose adjusted for normal eating. That is the full form of Daphne. So here the patients are taught about the amount of insulin they themselves have to take when they are at what time they have to take it before eating. Okay, after eating, at what time you have to take it. It's taught to them. It's delivered in a group format. A few diabetic patients together will be given this health education and counseling. Estimating the carbohydrate content in meals, how to estimate it, and adjusting the insulin dose accordingly. It will be taught to the patients. And with the help of Daphne, diabetic patients can live a normal life as possible on insulin. Okay. So here also the doctor will decide what type of insulin has to be used by the diabetic person, short-acting insulin or long-acting insulin. Okay, long-acting insulin, you have to take it bit earlier because it will function for a very long time in the body. Short-acting insulin, just immediately before you eat food or immediately after you eat food, shot has to be given, and it works for a very small duration. Okay, so this which type of insulin to be taken, doctor will decide it based on early subjective cases. Coming to the nutritional requirements of diabetic patients, energy 25 kilocalories per kg body weight is ideal. Okay, specifically when you are dealing with a hospitalized patient. Okay, those who are clinical nutritionists here, doctors here, dealing with a hospitalized patient, 25 kilocalories per kg body weight is maintained. And also, if the person is sedentary or moderately active, overweight, obese, ideal weight or underweight, how much kilocalories per kg body weight they should be taking. If they're diabetic, they have given it in a small table, table 19.7. Those who have the textbook, okay, you can refer that table as well. Carbohydrate, 45 to 60% of energy should come from carbohydrates in the diet, and carbohydrate restriction can impair the insulin sensitivity as well. So, and it is reversed by high carbohydrate diet. So high carbohydrate, high fiber diet can improve your insulin binding and increase the receptor binding capacity. Okay, so you do not have to run away from carbohydrates if you're diabetic. Okay, you have to use high fiber, high carbohydrate diet so that you can rectify the insulin resistance. So 45 to 60% of total calories should come from carbohydrates, should be in the form of polysaccharides like whole grains. Sweets, chocolates, sweetened drinks should be avoided, which can be rapidly absorbed by the intestine, because you have to give your intestine a lot of time to work with carbohydrates. So don't give them easy carbohydrates like monosaccharides or disaccharides, okay, which can be broken down easily. Don't give them that. Foods that have high fiber and low glycemic index. I'll show you the examples of that food in a while. And Indian diet is majorly cereal based. Wherever you go, North India, South India, West, East, okay, Indian cuisine is a cereal based cuisine. So we have to add more fruits, more vegetables, more complex carbohydrate should be only included in the diet. For example, for one meal or two meal, you have to completely replace the cereals with millets. Okay, because cereals naturally have a high carbohydrate content and they have low fiber content. Okay, so you have to replace a complete cereal based diet with a complete millet based diet in an Indian scenario. Proteins, high protein diet is recommended except in renal disorders. Okay, when you are suffering from diabetes mellitus for a very long time, chronic case of diabetes mellitus, slowly retinopathy, neuropathy, nephropathy will march in. Okay, so when you are in a stage, when you're dealing with a senior citizen or a person who is suffering from chronic diabetes, their kidneys have got affected because of frequently taking care of the glycosuria, ketonuria. Okay, kidneys naturally will get affected. The filtering capacity will come down. Okay, so in that situation, protein restricted diet will be prescribed based on their condition, based on what kind of kidney disorder they are suffering from. Okay, otherwise, high protein diet is good for them because a high protein diet mixed with high fiber and high carbohydrate diet will make sure that the intestine takes its own time to metabolize the food and absorb it. Okay, protein will not allow the carbohydrates to easily get absorbed into the intestine. Thus, it will prevent short-term spikes in the blood glucose levels. Okay, fat, 20 to 25 gram of visible fat. You have to be a little bit considerate when you're using fat. Low fat diet is better. It increases the insulin binding capacity. Go for MCT, medium chain triglycerides, polyunsaturated fatty acids. Omega-3 fatty acids should be taken. Trans fat should be completely avoided. Blended vegetables, oils should be consumed. If the diabetic diet is less than 1200 kilocalories, okay, for this person, also to control the weight or to deal with obesity, if you are prescribing them 1200 kilocalories diet or less than that, you will definitely require micronutrient supplementation, which means vitamin supplements, mineral supplements will be required. Okay, specifically vitamin C and vitamin E for antioxidant keratin supplements. Being on metformin is an hypoglycemic drug that will lead to low vitamin B12 levels. So B12 supplements would be required. Calcium and iron can be given to vegans as well. B12, calcium, iron, pregnant women, lactating women. Chromium. Most diabetics are not chromium deficient, but severe chromium deficiency can lead to glucose intolerance and insulin resistance. So chromium deficiency can be prevented, and it can prevent the loss of lean muscles as well. Zinc supplementation will reduce your insulin resistance. Zinc deficient people have shown reduced insulin secretion and high insulin resistance. So if you correct your zinc deficiency, it can work positively. Sodium and potassium. Dietary sodium may have a role in development of insulin resistance. So moderate consumption of dietary sodium is better. Okay, do not overconsume sodium. Soluble fiber, like isabgol, soluble fiber, 25 to 20 grams per day through fruits. Have the peel of the fruits as well if you can have a unpeeled fruit. Zinc deficiency, you can use multivitamin of zinc. Multivitamins which have zinc. Both type 1 and type 2 diabetes patients will require dietary fiber, soluble dietary fiber. Yes, zinc supplement can be prescribed. Fenugreek seeds, at least 25 grams on a daily basis, either through food or through fenugreek seeds tea. You can use the overnight soaking of fenugreek seed in water, or in powder form. You can put it on water or buttermilk and drink it 15 minutes before meal. It can reduce your blood glucose levels. Consumption of brown rice. If you eat white polished rice, switch that with brown rice. It can be much better. Coming to the nutritional requirements, artificial sweeteners, you can read about that. Aspartame, you have to avoid, because aspartame nowadays uh, it is associated with cancer. Stevia can be used. It's a natural sweetener. We can use stevia. So fenugreek leaves, it contained this special type of soluble fiber called galactomannan that slows down the absorption of glucose. In any form, if you can consume fenugreek leaf, either soaked in water, powder of fenugreek leaf in buttermilk, etc., it can also reduce your blood glucose level effectively. Best way of consuming is soaking it in water overnight and drinking the water next morning, or making the fenugreek leaves tea, okay, allowing the water to cool down, or have it lukewarm. Strain out the fenugreek and have it lukewarm. Empty stomach is the best time to consume. And also, even before you eat meal, just have a powder of fenugreek leaves over water or buttermilk. Drink it before you eat your meals. That can also be effective. Whatever suits you, whatever suits your timetable, there are different ways. Seeds. Leaves are also good. They are a good source of iron, folic acid, fiber. Leaves are also good, but here specifically seeds you have to use. Non-diabetic can also have it daily if you have a family history of diabetes running in your family, in your home. To prevent early onset of diabetes, you can also switch on to this. Major side effects of stevia is not known yet. It's simple things like nausea, vomiting, if you do not like the taste of it, low blood pressure. So artificial sweetener, these are the different artificial sweeteners a diabetes patient can use. Aspartame is associated with a certain type of cancer these days. To avoid aspartame, do not roast it completely, like brown it. You will lose the quality of it. If you want to dry roast it to make it grind easily, just dry roast it only until it turns aromatic. Okay, and as soon as you can feel the smell of fresh aromatic smell of the methi leaves, turn off the flame. Do not roast it completely. So glycemic index, not all carbohydrates are created equal. Okay, even if you have the same portion size of different kind of food, the blood sugar spike that you get from this is completely different. Carbohydrates that have a low glucose glycemic index 55 or less will make your blood glucose level rise very slowly and fall gently, as compared to high glycemic index food. Okay, some foods are naturally high in glycemic index. They will immediately rise your blood glucose levels, and it can come down immediately as well. Okay, frequent high spikes of blood glucose levels is seen. But the food that have low glycemic index, they will only rise your blood glucose levels in a very slow pace, and it will fall down also in a very slow pace. Okay, so for diabetic patients, food that come under this category of low glycemic index is prescribed. So glycemic index, you can take a screenshot of this. Food that has low glycemic index comes under the category of less than 55. So whichever food you can see here, whichever food which comes under the category of less than 55 is good for diabetic patient. Medium glycemic index is 59, 55 to 50, 69, and high is above 70. So all the food which comes under 55, there is a number given adjacent to every kind of food. Okay. The food that has the score of less than 55, 55 or less than 55 is good for diabetic patients. And also for women who suffer from insulin resistance because of polycystic ovarian disorders, for them also it applies the same. So this is where about watermelon, this is where we come to use we have to use the glycemic load. Okay. If you look at the glycemic index, watermelon has a high glycemic index. Okay. And ice cream has If you see the glycemic index of watermelon and compare it to ice cream has a lower glycemic index. But does that make ice cream healthier than watermelon? That should be a reason to it, right? Is ice cream healthier than watermelon? Because this is where glycemic load will answer the question. In glycemic load, the amount of fat, the amount of protein, amount of fat, also present the amount of calories given by the same 100 gram of watermelon, 100 gram of ice cream. Okay, the amount of calories given by these two. Okay, 100 gram of watermelon will hardly give you any calories. It would be less than 150 kilocalories, most probably. But 100 gram of ice cream can be giving you calories more than 300. Okay. So glycemic load will estimate all this. Glycemic load will estimate all this. Okay, glycemic index, this is the drawback of glycemic index. So glycemic index will give you a snapshot of which all fruits, vegetables, grains, and starches are good for diabetic patients. But if you want an in-depth knowledge, if you want to have a much more precise knowledge of how this, how the portion size, okay, how the portion size of these food items will impact your blood glucose levels, you have to switch to glycemic load. Okay. So here, glycemic index is just a rank. Index means it's just a rank. It's just a ranking system. Okay. So the 72 that you see here, it's just a rank. 61 is a rank. Okay. But you do not know how much, what portion of watermelon was used here. What portion of ice cream was used here. Okay, portion size, glycemic index will not give you an indication of portion size. Only glycemic load can give you an indication of portion size. Okay, so that's why we switch to glycemic load when we see this kind of, if you want to dwell much more into what exactly is good for diabetic patients. Okay. Dietary guidelines are available on page number 424. You can read it on your own. Do a self-study on that. Factors that influence the glycemic index. Read that on your own. And if you have any queries, you can reach out to me. So here you can see glycemic index and glycemic load as well. You can take a snapshot of this, a screenshot of this if you wish to. So the food that has low glycemic load, it means the food that can score less than 10. Okay, less than or equal to 10 is a low glycemic load food. It's highly beneficial for diabetic patients. Food that has a glycemic load of more than 20, equal to or more than 20, that is not good for diabetic patients. One or two dates can be taken, 1 or 2 dates, not more than that. Portion size is important here. Mango also has, you can see it's the score is 10. Okay, so you have to be careful with the portion size. Physical activity, that is exercise routine. Avoid exercises when you are in the state of hyperglycemia or hypoglycemia. When the diabetic person is in a hyperglycemic state or hypoglycemic state, avoid exercises. Okay, 150 minutes on a weekly basis is more than enough. Exercising right before or shortly after meal is also good. Is also good healthy practice. Moderate intensity aerobic exercises are preferred, like cycling, swimming, walking, brisk walking, okay, gardening, anything that can get your heartbeat racing faster, that counts as a moderate intensity aerobic exercise. Yeah, it almost means 1 cup is 1 katori, almost 150 gram, 120 to 150 gram. 100 gram will be too less for 1 cup. Body weight has to be maintained. Complications of diabetes when you are on medications, hypoglycemia is also a deadly situation. When the blood glucose levels, when you are on insulin and hypoglycemic drugs, etc., acute complications can take place. Your blood glucose levels can fall drastically low. Okay, that could lead to symptoms like sweating, trembling, hunger, confusion, drowsiness. You may feel dizzy and you may faint. Okay, so in this situation, immediately you have to eat something that has glucose water, glucose biscuit, something that has glucose, a candy. Okay, it has to be there. Always, a diabetic patient should carry something like that with them. Ketoacidosis, as I mentioned, any form of too much of ketone bodies being produced as a result of fat metabolism. There is intense thirst, too much of urination, constipation, muscle cramps, blurring of vision. Okay, hyperventilation, that is you breathe a lot, you feel breathless and you breathe a lot. Blood pressure is low. Fruity smell, okay, in your breath. That is ketoacidosis. Infections. Prone to infections, wounds will heal slowly, cuts and wounds will heal very slowly. Immunity is affected, risk of neuropathy, ischemia, tuberculosis. Fat metabolism is happening because the body requires energy. Cells are not taking up glucose, so cells require energy in some or the other way. So that's why the body will go into a state where fat metabolism is increased. And that's how you lose weight. Cataract and retinopathy, very common among diabetic patients because of the oxidative damage that accelerates once you are diabetic. When the blood glucose levels are high, that oxidative damage, the free radical damage that takes place in your retina and in your eyes is increased, and diabetes causes this increased oxidative stress. So risk of cataract and retinopathy is more in diabetic patients. Heart disease, any cardiovascular diseases. Nephropathy. Diabetic nephropathy is also a very common situation in which progressive loss of kidney function. Okay, not within a day or two. When you are suffering from diabetes from a very long time, okay, the progressively kidneys will lose its capacity because glycosuria is still happening, ketonuria is still happening, even though if you are on medication, some amount of glucose and ketones the kidneys have to deal with. And over a period of time, years have passed and the kidneys are still dealing with this situation, it would lead to the loss of function of kidneys slowly. And that is nephropathy. Then we have pre-gestational diabetes. A lady with known diabetes who conceives while on treatment with diet, oral hypoglycemic drugs or agents, or insulin. Okay, that is pre-gestational diabetes. It's a woman before she got pregnant, she was diabetic. Okay, usually type 1 diabetes, type 2 diabetes, or secondary diabetes mellitus. Okay, pre-diabetes. Okay? So a woman who was diabetic even before she got pregnant. So even during her pregnancy, she will be on oral hypoglycemic drugs, insulin, diet restriction will be carried out. Obesity is the risk factor of diabetes, but obesity is not the risk factor of diabetes in Indian community. The gestational diabetes mellitus is defined as the glucose intolerance of variable degree, and the first onset or recognition is during pregnancy. As soon as the woman is pregnant, her body goes into a series of reactions in which she gets diabetes, and as soon as she delivers the child, once the child delivery is done, labor is done, she comes back to her normal healthy body. And this is because of the hormones that have that function during pregnancy or functional during pregnancy that leads to this situation. So any woman who suffered from gestational diabetes during any of her pregnancy naturally has a high risk of developing diabetes earlier in life. Okay, even before menopause, she may get diabetes. There is fat metabolism is happening, but they are not gaining weight. When you get diabetes, you lose a substantial amount of weight. Okay. When a person is diabetic, whatever weight they were before they were diabetic, and once they become diabetic, they lose a substantial amount of weight because of diabetes. And once it is corrected, and if their lifestyle does not change, they will still be obese and overweight dealing with diabetes. But substantial amount of fat loss is seen in diabetes. Okay. Diabetes and alcoholism abstinence should be the main source of management. Alcohol can significantly affect your blood glucose levels. Okay, and it can interact with the medications as well. If you are on any medication, alcohol can interact with that. So always test your blood glucose levels when drinking. If you have high blood glucose levels, do not drink. Limit your drinking as much as possible, and never ever drink on empty stomach, because in empty stomach within seconds the alcohol can be absorbed into your bloodstream. Okay, so try to abstain from alcohol. Dietary supplements, as I mentioned, fenugreek seeds should be a part of your lifestyle if you are suffering from diabetes mellitus. Cinnamon has also shown to reduce the carbohydrate digestion, reduce hyperglycemia, and increase sensitivity to insulin. So cinnamon cinnamon green tea is also taken by people who suffer from PCODs. Okay, just because it helps the body to respond to insulin in a better way. That is one of the reasons why cinnamon green tea or cinnamon tea is referred to people who have PCODs. Then bitter melon, that is Karela. Okay, that's a very good option for diabetic patients to have a bitter melon juice, or to have any sorted recipe that has bitter gourd. Aloe vera. Yeah, before meal also you can take it, or on empty stomach also you can drink the cinnamon tea. Dried leaf juice of aloe vera or aloe vera gel. Short-term use can decrease the fasting glucose levels or triglyceride levels. Then there's gourmand powder. also called as Gymnema sylvestre. It's a leaf. It's an Ayurvedic medicine. So it has enzymes which can help the cells to take up glucose, and it can help stimulate the beta cells of your pancreas to release more and produce more insulin. So usually in Ayurveda it is prescribed. Dried leaf form or aloe vera gel juice